Hi, I'm Mitchell Ringos. Welcome to Word for Word, where we offer you an in-depth look at some of our interviews with newsmakers from across the Northwest. A local federal member of parliament is calling on the province to allocate a significant chunk of the recently announced federal guns and gangs funding to our city. Thunder Bay Rainy River MP Marcus Pulowski argues that the city's high violent crime rate proves that more support is needed.
Okay, and I read through your letter. Before we get into that, can you give us a bit of the background from the federal government, this guns and gangs funding between 2024-28? What exactly is that, and why is the government putting that out?
Well, previously, about 5 years ago, there was, I believe, about $60 million for guns and gangs. And this is kind of follow-up money to address a significant problem we have throughout the country.
Okay, and that previous one, can you build off that before, again, we get into this funding? How has Thunder Bay maybe allocated funds in that 5-year span?
Well, that's a little bit he said, she said. I mean, if you talk to different people, there's a possibility that maybe $200,000 came to Thunder Bay. But I talked to one person, they said, no, that wasn't from that money. And then someone else says it was from that money. But if it is, it's not a whole lot of money. I mean, $200,000, given the amount of crime we have in Thunder Bay, is really a drop in the bucket. So, and now why that happened, I don't think it's fruitful to get into that. I mean, different people will have different perspectives, but the bottom line is we didn't get any of it. And so this time around, I want to ensure that we do get some of it. So I am trying to build up the political pressure on the provincial government, because although this is federal money, this is our government's money, and we can kind of try to encourage the province to use it in certain areas. Ultimately, the decision's up to the province. So I want to try to ensure that some of that money, in fact, a substantial amount of that money, comes to Thunder Bay, because certainly we have a gigantic problem in this city. And so and the other thing is, I certainly don't want to see our taxpayers' dollars all going to Toronto to deal with guns and gangs problems in Toronto. Not to knock the fact that Toronto doesn't have problems. They do, but certainly we have proportionately probably a bigger problem in Thunder Bay than they have in Toronto.
And to that local aspect, crimes, gangs, drugs, can you speak more to that and maybe build on, you mentioned it briefly, but like how serious do you see the problem in Thunder Bay right now?
We are perennially either the murder capital of Canada or second. We're always in the running. The amount of serious crime in Thunder Bay are proportionately much higher than the rest of the province. Overdose deaths in Thunder Bay are higher. So kind of across the spectrum, we have a lot more problems with crime. It's not all guns and gangs, but certainly guns and gangs are a big part of it, and gangs coming from other cities coming into Thunder Bay and being involved in drug trade are a big part of it as well.
And obviously you're an MP here, you would say as much as possible, but is there a dollar figure in mind that you think would be appropriate to address the issues that we're seeing in Thunder Bay?
Well, given the fact that Ontario or Thunder Bay has a much higher rate than the rest of the province, I think we proportionately should get more than other places in the province, because I mean you gotta use the water where the fire is, and the fire is here in Thunder Bay.
Okay, and in terms of the funding that Thunder Bay does get down the road, well, hopefully does get down the road, how exactly is that allocated? Where would it be going in the community specifically? Would it be policing? Can you speak more to that?
Well, there are different funds of money, and there's other money to try to prevent people going into crime. And that's certainly a big part of our government's approach to crime. But I was a long-time emergency room doctor. And in medicine, yes, it's better not to smoke, to exercise, to not drink too much, et cetera, et cetera. But when somebody comes into the emergency room and they already have cancer, they already have a heart attack, you have to kind of change your mode. And similarly with respect to crime, yeah, prevent people from getting into crime. But once they're in crime and once they've committed murder, once they're robbing people, once they're dealing in drugs, I think you have to deal with those problems as well. So I very much see this guns and gangs money for policing, not for prevention. We should and we ought to put money into trying to make sure that people don't go into crime. That's totally appropriate. But we need to put more money into actually dealing with hardcore crime. And that's what this money is intended for, and that's where I want to see it go.
Okay, and maybe just a couple more questions. I guess moving forward, it seems like clearly it's something you're going to continue to advocate for. What exactly is that going to look like?
Advocating, well, this job's a long game, and this is one set of funding. There's other funding coming through. A lot of this is the province, and certainly I have a good relationship with Kevin Holland. I know Kevin Holland's on the same page with respect to this issue. But it's fighting one battle at a time, and this is certainly one battle. But there will be ongoing battles in order to get more funding for Thunder Bay, and I don't see any quick turnaround that we're going to suddenly drop to 30th in the country in homicides next year. But over time, I'd like to see that happen, and I think ultimately it will.
And my final question would just be, I know this is over the course of 5 years, 24 to 28. Do we know exactly at this point when the province may be announcing where this funding's going or being allocated based on region, community, area in the province?
My understanding was, at least as of last week, the province hasn't even received the money from the federal government. So it's going to be a little bit of time, and that's why I'm trying to get in front of this issue in terms of before they decide, because after they decide it's pretty hard, because everybody's going to want part of that money. But that's why I'm speaking now, because before they made the decision, I want to try to ensure that a healthy amount of that money comes to us. And I think we and Thunder Bay citizens are rightly going to be pretty ticked off if none of that money comes to Thunder Bay again.
Connecting to at-risk youth through skateboarding. Thunder Bay Police and Our Kids Count have launched the first Skate Collab program. It's part of the police service's community outreach efforts to help the kids get more comfortable with officers in a fun, active environment.
Okay, maybe start off, tell us a little bit about what's happening here today. Looks like a lot of kids having fun, a lot of officers around. What exactly is the program?
So the program is earlier this year, I met with my supervisor, and she had asked me what kind of project I had in mind, to do throughout the year. And I've been skateboarding my whole life, and it's been my passion forever. And I've always wanted to have an opportunity to be able to pass on my love of skateboarding to the community and do it through the police to kind of show that we're regular people too. And the benefit of doing it through this program was that I was able to come in skateboard clothing, and I'm just one of them, but they all know that I'm a police officer, and it's built really good relationships so far, and the kids are just having a blast. Yeah.
Speak more to that. What kind of reaction do you see from the kids when they're out here and having a police officer teach them to skate a little bit?
Well, they keep coming up and asking me for Gatorade because I bring it every day. But yeah, they're very receptive to learning and watching them persevere through the challenges. Skateboarding is very difficult. You know, when you fall, it's not very forgiving on concrete or pavement, but they get back up, they dust themselves off, they'll take a break, and then they'll get right back onto it. And they're always open to suggestions and learning, and then wanting me to skate around and do some tricks for them just to see what you can accomplish skateboarding.
How many of these kids had skated before?
I think there was maybe one or two that showed up with skateboards that had skateboarded before, but they were very, very beginner. And this is only day 3, the beginning of day 3, and I've seen so much progress with them. And I was saying earlier to somebody else that one of the things that I love to see in skateboarding that I learned was the perseverance that you learn. Again, you're not going to get it first try. Sometimes you do, and that feels great. But, you might try something 50 times. Once you land that, the feeling that you get is you can't even match it with anything else. And to watch them with the smiles on their face, they've all developed friendships with each other. And we also, yesterday, we had them all in the bowl, kind of helping each other climb out of the deep end, which is probably 12 feet deep. And they were laughing, and now we've got a couple friends that are just hanging out and skateboarding together and encouraging each other. So that's probably been the biggest thing for me that I've noticed, and it's been phenomenal.
Talk about this as a way of building that trust between the police service and the younger generation. Kids are little troublemakers here and there. They think, oh, a cop, I don't want to get in trouble. But what is it building that trust through programs such as this?
I think they're going to see that, again, me not being in uniform, but also like being from a skateboarding background and having this as, something that I've been doing forever, and knowing that they can approach me, ask me questions. It's less intimidating without a uniform, and to show that, the days of running from the police when you've, whatever, you don't have to do that anymore. You can approach us. We're here to help. We want to build that trust with the community that we're, it's cliche to serve and protect, but that's really what we want to do. And if kids are in a crowd and they lose their parents and they see a person in uniform, just approach us. We're going to find your parents. We're going to help you out the best we can. And, again, it's the kids watching them smiling and seeing how happy they are and not being discouraged that I'm a police officer. I don't have that uniform to scare them away, but also to remind them that it's okay, that if you have a uniform, you don't have to be scared of that.
So we're talking about trust in police. I have to ask, we know that there are issues with trust in the police in the community, especially among Indigenous families. Do you have any concerns that police presence in this program could maybe keep some people away from a program like this?
It's possible, but again, I look at it as it's not the end goal would be to have everybody come together as one big community, but it's going to take time. And I think this is one step that we can take, and that's how I have to look at it, is that one thing that we can do to show the community that we're here to support them, break down any barriers. And, again, I'm hoping that this program runs, we're running the next month, but I'm hoping that it runs yearly after this, and then different kids cycle through, get to experience what skateboarding's like, and build those relationships.
Local nurses and other Frontline Healthcare staff from 5 labor unions rallied in front of the Regional Health Sciences Centre recently. They continue to protest the Ford government's plan to allow private clinics in Ontario to offer more health services.
People recognize that there was some severe shortages and some challenges in the public system became very apparent during COVID. But since then, I think people are really just wanting to get the services that they deserve at any cost. And I think that publicly, most people don't understand that when you're paying with the health card, you're actually not really paying with a health card, and it's all good until those health card services are also gone, right? So it's very, it's very detrimental to our public system.
What are your concerns in the long term? Because I know it sounds like you're saying this could be part of a bigger kind of march towards privatization. We've heard those concerns elsewhere. So maybe just talk a little bit about your wider concerns beyond just what's in this exact field.
Yeah, I mean, it's the beginning of the total dismantleization of the public healthcare system, right? Where, I was just traveling out of country, I hurt my shoulder, I had to go to an urgent care clinic, and the first thing I had to do was hand over my visa, and they couldn't even tell me what the cost was going to be. Now it's just to see a doctor without any care, no diagnostics. It was $750 American, and I got a little linen sling with a safety pin and sent on my way. So, I mean, that's what's going to happen here. When you start to bleed out, take the staff and the resources from the public system and privatize that, because who's not going to want to work a 6 or 7 hour day for more money at first, without the stress, without the shift work? Anybody is going to want to have the opportunity to do that. So it will just start to unravel. People actually recognize that many of our services are already public. So, in January, the government announced that pharmacists can now prescribe or treat certain ailments, like 13, expanding the scope. That's private. That's a private service. And so it just will continue to trickle out.
And do you think there is any chance that these changes could reduce wait times for patients, even if they have negative impacts on staffing? How do you expect this to impact the public when they seek services at the hospital or elsewhere?
Yeah, well, you're seeing it down east. They're actually opening surgical rooms that could be open right now if they hadn't cut more and more money to the public sector. Bill 124, I think, was really an opportunity for the Ford government to create such a crisis in the public system that people are more willing to just, give up maybe, or not clearly understanding what the bigger picture looks like. I'm a mom, I'm a wife, I'm a daughter, and you automatically want to do what's best for you and your family. So it's a little unnerving. Honestly, it's a little unnerving, but we'll see it as roll out. So there'll be the haves that can afford it and that can pay the up fees, the extra fees that working people can't. And it'll create such a divide there that the system will fall apart for sure.
What does it mean to have all these provincial union leaders and all 5 unions kind of I guess just coming here with the same message
Yeah,
today.
this is a really historic process. The 5 joint unions, so the 5 largest healthcare unions in Ontario, have been working together, planning these events, planning these fight back campaigns. Where some of the ones that are taking place in Southern Ontario, where workers are walking right out of the hospitals, and knowing that if we don't do something drastic and we don't work together, then we're not going to win this fight. So this is happening right across Ontario. All 5 unions are working together in the planning, in supporting one another, and of course the monetary types of campaign issues, and then just replicating this right across Ontario.
And if you could just describe for somebody who doesn't really know what's going on here today, exactly what this whole rally is all about.
Sure, yeah. The Ford government has introduced and passed Bill 60, which would privatize a whole number of healthcare procedures, from hip replacements, knee replacements, eye care, all that kind of stuff. So what we're looking at is actually a rally against the privatization of healthcare, and this includes 5-union project. So we have CUPE, the Canadian Union of Public Employees, their hospitals branch. We have our Hospital Professionals Division, Unifor, the Ontario Nurses Association, and SEIU. All of us have come together to say enough is enough. We are done. We are going to stop the privatization of healthcare.
And that was a great answer, by the way.
Okay.
And if you could just describe what the goal here today is, and just how much support is going into this.
Yeah, I think what you are looking at is the local leaders who all work at Thunder Bay Regional Health Services have all gathered 1,300 signatures on a petition calling on their CEO to take a stand against the privatization of healthcare. We have a government that is sitting on billions of unspent dollars in healthcare funding, and yet they're punching down on workers. They're continuing an appeal that says workers' wages are capped at 1%. They are continuing with the pressure on Bill 60, and enough is enough. Workers are done. These people have been called heroes for the past 2.5 years of the pandemic, and now they're being treated like crap and being told that they're not worth it. That we're being told that our public healthcare system should be sold effectively to the highest bidder, and we are done. We are standing up and we are saying no.
And 1,300 signatures, as you mentioned, but how many people are expected to come out and rally today?
I don't know how many people will come out and rally, but every single person that comes out and rallies represents a whole host of people on the inside that have to work today or that can't take the time off. But what we have seen is an incredible upswell. This is the 5th rally that we've seen in communities across Ontario, and these will continue until we knock back Bill 60.
And did you have any questions there?
Yeah, well, so the Ford government's line on this bill, I guess, the privatization elements, is that it will help reduce wait times at local hospitals and that people can still show up with their OHIP card and access services that way. So what is your response in terms of your concerns over how this will actually impact hospitals?
Yeah, so when he talks about reducing wait times, it actually does nothing around wait times. What it does is actually download the more complex procedures into the public system while allowing the private clinics to skim the cream, the procedures where they can make money on. There's also the question of upselling, right? So you might be able to use your OHIP card for some procedures, but if you want to jump the line, maybe you want to pay a little bit more. It's like being bitten to death by ducks, right? I'm from the United States. I know where this kind of road leads to in terms of the privatization of healthcare. And what it will do is create a difference in accessibility for poor and average income Canadians and allow the wealthy to jump the line. It will also strip the resources in workers from our public system and drag them out into the private system. And the Ford government has laid the foundation for this very clearly. This is a manufactured crisis in healthcare.
Thanks for joining us for today's edition of Word for Word. We'll be back next week with more interviews from across the Northwest.